joining us now. Dr. Richard Besser, former acting CDC director, now the president and CEO of the Robert Wood Johnson Foundation. Dr. Besser, thanks very much for being with us. Infections now, a year later, appear to be trending down after plateauing at a dangerously high level, of course. But some states are lifting all restrictions. How much do you worry that we're going to see another surge?
Well, Andrea, at the highest level, I'm cautiously optimistic by the trends in cases, optimistic about the increasing vaccine supply and the increasing efforts to get vaccines to people where they are, reaching the communities that have been hit the hardest. But I do worry. I think we need a real a sense of cautious respect for this virus and what it can do. We've seen over the course of the past year downward trends quickly reverse. I don't think that's going to happen here because of the rising number of people who've been vaccinated, the number of people who've already had this infection. But I do think that if states rush to remove the public health restrictions, the restrictions that have been shown to save lives, that we still could lose thousands of people whose lives could be protected if we're more careful. It's not the time now to discard our masks and come together in crowded indoor places. This is the time to stick to the roadmap that's being laid out by public health. I expect over the next few weeks, they're going to increase the number of things that people who are fully vaccinated are able to do, and that gives me a lot of hope. And how big a threat are the variants to our hopes of getting back to a normal life? Yeah, I mean, that's one of those unknowns. There's some new data out of South Africa that's somewhat more encouraging because they're seeing a big downward trend in cases there as well. And we are seeing signs that the vaccines are protecting from a lot of the variants that are around. But this is something where the science is still out. And it's one of the reasons, I think, why the CDC hasn't let people do more of the things that we all want to do, because they want to look to see and make sure that people who are fully vaccinated are protected against the variants that we're aware of. They want to make sure that they're able to detect new variants as they spring up. Whenever there's a new infectious disease, what we don't know far outweighs what we do know. And so being careful, being cautious, going slowly makes the most sense in terms of saving lives. There's an Israeli study now that shows that Pfizer's vaccine blocked 94% of asymptomatic infections. So does that give you hope that there won't be transmission of the virus to unvaccinated people? It does. When the CDC published the guidance that says you can get together if you're fully vaccinated with other fully vaccinated people, they also included a science review on that question. And there's increasing data that vaccines do prevent transmission. So not only do they protect the individual, but they could protect people from spreading it to others. And that will allow us to do more. As that science gets solidified, as the comfort level goes up, that's extremely encouraging information. One of the questions, though, that is still outstanding is how long you get protection from vaccines. And we have to remember that these vaccines were approved for use with just 2 months of data. So as the months go on, we'll be able to see even further how many months protection do you get? Does it start to fall off? Do we need to be concerned about that as we're increasing activities? Thank you so much, Dr. Richard Besser. Thanks for being with us today.
Thank you.
Thank you.
Thank you.
Thank you very much.
Thank all of you out there.
Thank you as always.
Thanks to at home.
Thanks for watching.
Thank you so much for letting us into your homes during these extraordinary times.